Welcome to Pacific Fertility Center's injection training. This training will show you step-by-step instructions to prepare and administer your Menopur injection. We suggest that you watch the video first before you prepare the medication. The first thing that we're going to do is wash our hands and check the physician's order for the amount of Menopur prescribed. Please look at your calendar or your portal. Today, for teaching purposes, we're going to teach how to inject 150 units of Menopur, which consist of mixing 2 vials, which are 75 international units each. First, we make sure that we have all the necessary equipment and prepare everything in a clean area. We'll need a 27, 29, or 30 gauge half-inch needle, a Q-cap, an alcohol swab, a cotton ball, sharps container, 3 ml syringe, 1 ml of sodium chloride, and please note that 1 vial of sodium chloride can mix up to 4 vials of Menopur. Then we need our Menopur vials, and please make sure that the vials have not been opened and are not expired. This is how you mix 150 international units of Menopur. We will be demonstrating with 2 75 international unit vials. If your prescribed dosage is 75 international units, then you will only be working with 1 vial. First, you take out the 3 ml syringe from the wrapper. You're going to untwist the needle that is attached to the syringe and discard it into the sharps container. Without touching the tip, remove the Q-cap from the wrapper and attach it to the syringe by twisting it on. The Q-cap looks like this. We need to add 1 ml of air to be able to withdraw the medication from the vial. To do this, we pull back on the plunger to the top black line and set it to the 1 ml mark. Then you're going to lay the syringe down, remove the metal cap on the sodium chloride vial, insert the tip end of the Q-cap by firmly pushing down on the sodium chloride vial. You push the plunger down to inject the air and hold it down. So while you're holding it down, turn the vial upside down and pull the plunger back to draw up 1 ml of sodium chloride. You may notice a few air bubbles. Don't worry about that just yet. Try to withdraw a little bit more fluid by holding the plunger down and then setting it to the 1 ml mark. Then you may tap gently on the syringe to remove the air bubbles. If you notice that you are unable to withdraw any fluid from the sodium chloride vial, you may have forgotten to add air to the vial first. To do this, we pull back on the plunger to the top black line and set it to the 1 ml mark. Then you're going to lay the syringe down, remove the metal cap on the sodium chloride vial, insert the tip end of the Q-cap by firmly pushing down on the sodium chloride vial. You push the plunger down to inject the air and hold it down. So while you're holding it down, turn the vial upside down and pull the plunger back to draw up 1 ml of sodium chloride. You may notice a few air bubbles. Don't worry about that just yet. Try to withdraw a little bit more fluid by holding the plunger down and then setting it to the 1 ml mark. Then you may tap gently on the syringe to remove the air bubbles. Once you have 1 ml of sodium chloride in your syringe, remove the syringe from the vial by pulling it apart with both hands. Set the syringe down on the clean surface. Take one of the Menopur vials, remove the metal cap, and then insert the Q-cap tip into the Menopur vial by pushing the plunger down to ensure that all of the sodium chloride is inserted into the Menopur vial. While holding down on the plunger, gently swirl the Menopur vial until all of the powder has been dissolved. It should appear clear. Turn the vial upside down and gently draw back the plunger to ensure that all of the liquid from the Menopur vial is in your syringe. You may tap gently to get rid of any air bubbles. Then you're going to pull the syringe from the Menopur vial to separate the two. We have now mixed one of the 75 international unit vials of Menopur. So if your prescribed dose is 75, then we're done. Now we need to mix the second vial because we're mixing 150 international units. We have completed the preparation of the Menopur medication. Now we're going to teach you how to inject your medication. First, you unscrew the Q cap with the attached vial from the syringe. Unwrap the 27, 29, or 30 gauge half-inch needle and twist it on the syringe. Set the syringe down on the clean surface, and now choose an area on your belly that is 2 to 3 fingers away from your belly button. You may choose an area away from your waistline, since tight pants may irritate that area, or you may choose your inner thigh if you're very thin. Please keep away from red, bruised, scarred, or irritated skin, and always choose a spot that's at least 2 inches away from the last injection. Then you're going to clean the area you've selected with alcohol. Please make sure you're sitting down when you're giving yourself the injection, just in case you're feeling dizzy or anxious. Now we're going to give the injection. Pull off the cap of the needle. You may push up on the plunger until you see 1 small drop on the needle. If you still see any tiny air bubbles in your syringe, point the needle upward and gently tap on the syringe until they're gone. Do not let the medication escape. Then, pinch an inch or so of skin. You will inject with a fast but not stabbing motion and insert the needle and then release the skin. Count 5 seconds. Do not move when you inject the medication. Remove the needle and apply pressure with a sterile gauze. Hold the pressure for 1 minute, counting 1000 to 1003 to 1000, and this helps to prevent bruising. Throw the entire used syringe into the sharps container. You have now given yourself the medication. Let's summarize the key points. It's important to rotate injection sites and choose areas that are not red, bruised, scarred, or irritated. You may want to ask someone to assist you in administering the medication. Thank you so much for taking the time to view this video. If you have any questions or concerns, please call or email your care team. We're here to help. We wish you every success. Good luck.